Hi, my name is Donna Mines, and I'm here to talk about the opioid issue crisis that is going on around today's world. So I have the cards with me right now. I'm sorry. In 2018, I was a victim of opioid addiction. It was February 2018. I was in a car accident. It was so bad that I had to be prescribed with a painkiller medicine. Luckily, I had my mother who helped me through because of the experience that I had with opiates. They felt good, and I had no idea that opioids were an issue, and I was grateful that I had someone looking after me, knowing how addictive medicine were. The government needs to focus on being responsible and taking care of the crisis of opioids misuses, such as people who go after painkiller medicine illegally, and help people who are not able to afford a life, job, or house, or mentally stable. Federal government should change insurance policies for free to not only doctors, but with therapies that needs to be back on their feet, and will be able to help thousands of homeless people and people in general who are battling opiates. An opioid is a drug that is known to act on the nervous system to relieve pain, along with heroin and illegal drugs that produce morphine-like effects. Opiates are used to help insurance patients, which is true. However, it is important to prevent opioid-induced overdose and death, and work on heroin in other ways, such as therapies, and providing a government assistance to help homeless people in overdose addiction. People who are on the risk of opioid overdose. To begin with, opioid crisis remains a major health issue in the United States and beyond. It has been largely driven by non-medical prescription opioid usage and heroin usage. However, in the past few years, deaths have dramatically increased because because of the easy access of synthetic opioids from illegal drugs markets where homeless people would go to and use. Not only that, people would buy painkiller medicine at the stores to use as well. Homeless women would go after illegal drugs that are cheaper to stay away from depression and further from major roles in society. According to article From Darkness to Light, art therapy for homeless women with co-occurring opioid use disorders. Homeless women will confess that they would go after illegal drugs and hunger for happy place of their own to cope with highly stressful life situations, such as family conflict or dysfunctional traumatic loss or harmed devastating medical condition, abrupt career detour, or disastrous financial loss, and effective self-medicate. Individuals who inject drugs have strong craving or desire for drugs. That will be the consequences of higher risk of experiencing and witnessing an overdose. This can lead to death. Now, homeless is a brief circumstance and not a durable condition. Pursuing this further, opioid issues can be helped to detain it by art therapy. Art therapy is a mental health treatment that utilizes traditional processes of counseling and psychotherapy, and to integrate with creative processes of artistic expression. Art therapies can boost the process of recovering for the individual by improving mindfulness and building a means of spiritual connection, and reducing shame and anxiety, therefore increasing the likelihood of long-standing sobriety. It is a process to help people resolve conflict and conduct grief counseling, boost self-esteem and well-being, and work on their unfit behaviors and condition. Art therapy comes in many therapies, referring to paint therapy, dance, and movement therapy, music therapy, drama therapy, and many more. In addition, one of the therapies particularly working on in patient settings possesses a unique opportunity to identify the substances use issues and multipleize and affect treatment response during a critical window of time is dance therapy. Dance therapists stated that in the start of the session, that it is important to establish physical movement is a pathway to recovery that enables the restoration of self-awareness and skill that it is hindered through the use of drugs and alcohol. For that reason, that opiates can impact the ability to develop healthy relationships to self and others. Dance therapists observe these actions as an opportunity to achieve insight and improve while emulate in a safe community for their client to be honest and real. Dance movement therapy and unique response to an opioid crisis. It is important job to help patients to feel comfortable talking and be aware of their surroundings. Dance therapy also uses their tools as music to help their patients to stimulate movement patterns, which stimulate being the influence that's providing an opportunity to address behaviors. Music is also a therapy that helps resolve an unfit behaviors and condition. Music therapy is the applied use of physical, emotional, social, athletic, spiritual, mental, and social aspects of music intervention to affect positive changes in individual lives to assist them and reach individualized therapist goals. As it was mentioned in the sensory art therapy for self-management of chronic pain system. Music therapies are known to relax muscles and pay attention to your pain. And music as an adjunct to opioid-based and analgesics, spoken about how music therapies spoke about how music helped to improve the opioid crisis. Understanding the ability of music to moderate pain may provide alternative opioids that improves understanding of relationship between pain, stress, anxiety, and neurotransmitter, which moderate these states will help investigators tailor music as personalized therapies for individuals with chronic or substance abuse. Their tools are not only things therapists use to help patients that are addicted to opioids. The therapists also acknowledge patients how to use Nasoline. Nasoline is a drug that helps to clean out to help you prevent from getting addicted to opioid drugs such as painkiller medicine. As in this article, Dance Movement Therapy, a unique response to opioid crisis, it mentions that therapists may consider meddling creative discussion of addiction resources by stimulation, talking, and movement through exploration of when and why and how to use Nasoline, or incorporating screening, brief intervention, and referral to treatment. Nasoline is a synthetic drug that blocks opioid receptors in the nervous system. To draw your attention, therapists are not the only one that hand out Nasoline patients. Policies also give out to the Nasoline to homeless people who are addicted to opioid. Under the Opioid epidemic a call to action. The author mentioned that he met someone police that would carry Line to save people. Police officers I met in Seattle began carrying Line in spring of 2016 and saved 10 lives within a few months. The police mentioned that the work they done was the most rewarding work they've ever done to help people. To sum all this up, opioids is a huge issue to society. I think this helps them to drain all the addiction of opioids to be back in their life and their family and their loved ones. Yet, and briefly, government will need to help hopeless people with financially to society to get back on their feet after being treated with opioid addiction. That's all. Thank you.